This is Health Matters, a podcast from Mayo Clinic where we discuss the latest medical advice, news, and research to help you live a happier and healthier life. My name is Kristen Meinzer. I'm a writer and journalist, and this episode, we're talking about understanding health news. Now, more than ever, learning about our health demands detective work. Should you believe this new buzzy headline telling you what to eat, what to avoid at all costs, or what supplements to try? And when the news says this, someone on TikTok says that, and your neighbor tells you yet another take from a magazine, it can be hard to know what's real, what's fake, what's a scam, and what's simply a misinterpretation. To tease out the truth, we're talking with Joy Heimgartner. She's a registered dietitian with Mayo Clinic in Rochester, Minnesota, for the outpatient blood and marrow transplant program. She's also an assistant professor of nutrition at the Mayo Clinic College of Medicine and Science. She's here to teach us how a study becomes a headline, red flags to watch out for, and what you can do to combat misinformation. Joy Heimgartner, welcome to the show.
Hi, thank you for having me.
We are so thrilled to have you here with us today. But before we get into it, since you're a nutritionist, I imagine you often get asked about things people see online. How common is it for people to come to you having heard inaccurate information?
It's pretty much a daily occurrence. I mean, I think a lot of the information that patients, friends, family, other people I interact with are seeing, we're just bombarded with information. As a dietitian and a dietitian who works in the cancer space, it's kind of double whammy, right? There's a lot of information out there that sometimes causes some fear and anxiety. And a lot of times the information that's available to us on the different news sites we're on or social media, there's like a kernel of truth to it, which is like, okay, that part is believable. That sounds like it could be legit. And then sometimes it expands into things that, okay, that doesn't sound like it could be legit anymore. And so I get questions on a regular basis. Sometimes I know the answer, sometimes I don't, and then we go investigate some more and try to figure out what's the truthiest truth.
What is the least truthiest truth? What's the most outlandish thing that you've heard from friends or family?
What's the craziest thing you've heard?
Oh my gosh, I'm constantly being fed stories, forgive the pun, about not eating. Like, if you just fast for 72 hours straight, your cells will regenerate at 10 times the rate. Or if you just fast, all of your IBS will disappear. And it's like, it seems like you're giving a lot of credence to not eating for 3 days.
Yeah, right? And the topics that come up, they tend to be a bit cyclic. And I'm sure within the next month, there will be some new thing. And yeah, fasting has definitely been a big one for the last several years. The other things that always get me are there's some specific food or nutrient. And it's like, well, you have to eat this, whether it's acai berries, like you have to have these in your diet.
If you're not eating chia seeds, you're asking for an early grave.
That's right. And you're really hitting on some of those things that we know should be red flags, right? Those dramatic, dire consequences if you don't do everything perfectly. It's a little trickier when the headline is a bit more moderate. I just read a headline, and you have to understand, I am a cheese lover. I love all kinds of cheese. The stinkier, the better. I just read a headline, and it said that a 25-year study reveals that high-fat cheese and cream may stave off dementia. So I'm like, well, first of all, 25-year study, that seems pretty significant. And cheese, so I'm like, I'm going to share that thing because I love cheese. But then when you dig in a little bit deeper, you know, it's not quite as dramatic as it was made to sound.
It seems like a lot of the stories that seem most exciting are the ones that are like, oh, that's what I'm already doing, right?
Yeah. Our human brain likes to latch on to things that drive some emotion in us. So it can be either that it confirms something we already suspect. Any headline that says anything good about cheese or coffee, I'm latching onto that because those two things I love. So things that confirm our already preconceived notions, those are things we tend to attach to as, okay, I believe this one. Sometimes things that create fear in us because it caused us a large amount of emotion. And so we give it more credence than maybe it's worth. And that's why when you're evaluating headlines and social media, a lot of times there will be things that are said to either confirm preconceived notions or to make things sound really exciting and absolutes like you're talking about, or being told this will kill you. If you keep eating pizza every week, you're going to die an early death. The fear is a big one in the cancer nutrition space for sure. And I get patients who come to me and they've been trying to navigate all the information about cancer nutrition that they're hearing from outside sources. And a lot of times it's caused them to have so much food fear that they're no longer actually eating foods that they need to be eating to nourish their body. And so it's very challenging. People want to do the right thing. And having trusted sources to get the information from, we have to do a little bit more work for it because there's a lot of sources out there, lots of influencers, and maybe not even people with poor intentions, but people who don't have the greatest intentions that are trying to either make money through clicks and shares or get you to buy their supplements. That's incredibly popular in my area.
So we latch on to things we want to be true and or that drive some emotion in us, negative or positive. Is there anything else that makes us prone to believing misinformation?
Our human brains are so efficient. We can take in facts and make assessments quickly. But when we have gaps in information, our brain uses emotion to help fill that in. That's great because it can help us make decisions quickly in our day-to-day life. But it doesn't always help us get the right information in. And when we start hearing something over and over and over again, which is one of the downsides of the internet, is that once information is out there, it is out there forever. And you can type in a search for a topic and you can find something that was talked about 10 years ago that has been since debunked, but you're still going to find that information. And your brain says, the more I read this, the more I hear this, the more true I believe it to be. And so when the wrong voices are giving repetition to things that are not accurate, it makes it really hard for those of us in the space that are trying to help people with accurate information. It makes it hard for our voice to be heard sometimes.
Oh, that's tough because we really just want to understand things. And when we do reading up, it's often because I want to do better. I want to be better. It's not that we're trying to do things wrong. It's just that all this information is hard to parse through. There are some sneaky ways that misinformation takes hold in our brains. For one, we tend to latch onto things we already suspect or want to believe are true, like positive things about cheese, chocolate, coffee, or red wine. Misinformation can also take root by inciting an emotional response. It can capitalize on a positive emotion like delight or intrigue, or a negative one like fear. Like when an article promises eating this one food every day will make you lose weight. Or eating this other food is a horrible mistake that's been undermining your weight loss. Perhaps the sneakiest of all is that we tend to think things are true the more times we hear them. So even if the correct information is out there, if we hear the incorrect version over and over and over, we often start believing it without even realizing it. But how do we even figure out what's true in the first place? Let's learn some strategies for evaluating the truthiness of studies, articles, social media posts, and even AI. So let's talk about how we can better parse through all of this information, how we can cut through the misinformation of all of this. So studies. Sometimes we'll see a study and we'll think, yes, this is the information that I need. But there's more to it than that one headline. So can you talk us through how to better understand when we see a headline about studies or a line in an article? Well, this study proved this.
Yeah.
What should we be looking for when the word study comes up?
So when I read a study, I'm not thinking to myself, this is going to change my practice. What I'm thinking is, how is this going to add to the body of evidence? There are studies out there that you could confirm absolutely anything you wanted to confirm. I mean, it really is true. There's never a time when one single study is going to change our practice. That's not how science works. We're constantly evolving, but it's a bit slower process because we have to evaluate the quality of that evidence in that study. In the news and the headlines, it tends to be, this is the study. And again, our human brains are black and white, and they're like, okay, this says that high-fat cheese is going to prevent me from having dementia. I don't want dementia. I'm going to go out and eat myself a wheel of brie tonight. And if you dig a little bit deeper, you find the specific types of patients that were studied in that study. You find that the risk wasn't terribly different in the different groups, hardly met the statistical significance. And of a study of 25 years, there can be lots of confounding factors that are hard to accommodate for. So I think it's pretty common in the lay public to read about a study and think, oh, this should change how I work. This should change how I eat. This should change what my diet looks like. In the clinical world, we're asking, how is this going to change how I talk to patients? Would this change how I talk to patients? And of course, I'm not going to ask patients to suddenly go out and eat high-fat dairy to prevent dementia. I know that the biggest killer of Americans is heart disease, and there's unfortunately a lot of links with higher fat dairy and cardiovascular risk. So I'm going to be very cautious about how I talk about that. But a lot of time, that one single study conflicts with this huge, I always say, we have a room full of evidence that tells us this. And so extraordinary claims require extraordinary evidence. When you read these flashy headlines, it's like, that's an extraordinary claim, and you're going to have to give me more evidence than this study of 100 people that don't even meet the same types of criteria that my patient population might meet.
So what are some questions people should ask or signs they should look for to determine if this study that they've just read about is legit, or if they should be trying to emulate the study?
One of the things that I think is helpful with the internet is that a lot of times when a major news outlet talks about a study, they oftentimes put a hyperlink right to the study. That's great. However, if you've ever read a scientific research study in a journal, it's not always that straightforward. I went to school for several years and took many classes just to learn how to read the paper, and sometimes I still need people's help to explain to me certain things. For instance, in this high-fat cheese article that I just read, there was a link to the actual journal article, and it's open access, so people have access to viewing it. Then you have to sort of understand how the study is put together. And for any study that is published in a peer-reviewed journal, there are reviewers who have looked at, hey, did the methods they chose to use, is that appropriate for the question they were trying to answer? And if you're not finding articles from peer-reviewed journals, I would be very, very cautious, because you can distort a lot of information very easily by either asking the wrong question or going about determining the answer to a question in a way that doesn't get rid of some of the noise that you need to get rid of. So number one, look for a peer-reviewed journal, making sure you're choosing a study that was done well. And we do that by looking through the information to see how is this presented. If you read a journal article, it's way more boring than reading a headline, because usually the authors are being very careful about what they say their study found, and also saying, well, it didn't find this, though. And in the future, we need to look at this more closely. Or these are the limitations of our study. And a good study will talk about those things.
Even if a study is in a peer-reviewed journal, is it obvious who is actually part of the study? Do they lay out the demographics? Do they lay out the number of study participants? Do they lay out whether or not they were observed, or if it's self-reported data that they're dealing with? Is that all there too?
They should. Those types of things should be in the printed study. But that's the part to look more closely when you read the headline that says high-fat dairy might prevent dementia. If you dig deeper into that study, there's specific groups of patients where they showed it might have benefited. Other groups, they showed no benefit at all. So if I have somebody who says, well, I heard that such and such a supplement would prevent my cancer, and then we look it up, it's like, well, that's in patients who have specific brain sarcomas, and you have a blood cancer, and there's no evidence that that's the same thing. Mm-hmm. And so we can't always generalize that to a general population. It can help inform how we research future things, but we can't say this worked in this small group of people, so everybody should do it. And that's not what we would do in science.
And I imagine that goes beyond different types of cancer to also include different genders or people of different geographic origin and a number of other factors I'm not even thinking of right now.
Yeah, and that's one of the reasons it's so important in research to be including as diverse of populations as we possibly can. Like, say, I want to study this one topic, but I only want to study it in white males aged 18 to 30, because I know that's going to keep me from having some other confounding factors of sex hormones or age-related things, or maybe even some genetic factors that might pop up. And that's fine, but then the results you get from that are going to be limited for any other population. And we have a real historical problem of not including in medical research enough variety of people. And I'm not just talking about variety of sexes like male or female, but also racial diversity, economic diversity, because especially in the nutrition space, we're not just talking about food, we're talking about people's diet and their whole environment of how they procure food and eat food and enjoy food and use food for their health. Your socio-demographics make a huge difference. Those social determinants of health can make a huge difference. So making sure we have diversity among study subjects is incredibly important because it does make the study more powerful for actually using it to change people's lives.
So a study, if it's done well, will make clear who's actually being studied, how long the study went on for, the different methodologies enlisted for the study. This is all great. But let's say we're not even going into the study. We're just relying on the journalist, the author, the TikToker, what have you, to interpret for us. What are some things that we should be looking out for?
When you're looking at those headlines, it's always important to be a little bit cautious. And there's some red flags that are helpful. So the International Food Information Council has 10 red flags of junk science. So any recommendations that promise a quick fix, those should be a little bit of a red flag. Those dire warnings that we talked about, claims that just sound too good to be true. I mean, sometimes we need to trust that first instinct of our brain, like that seems a little bit too crazy. Another one is like when people draw really simple conclusions from a really complex study. Studies that are good oftentimes go on for a long time and they're extremely complex and they can't just be boiled down to a few sentences on a social media post or within a 3-minute video. And so anybody trying to oversimplify things, also I would be cautious about that. Anytime somebody makes recommendations to change what you do based on a single study, that should always be a red flag to you. Single studies don't inform how we change guideline recommendations in health. In nutrition space, I don't particularly find it helpful, and I find it a red flag when the article talks about good foods and bad foods. That moralizing food isn't something that we do in science. We've got foods that contribute to our health more than other foods, but good and bad isn't a helpful way to talk about it, and that should be a red flag. Of course, anytime that there's a recommendation that sells you a product. Yes. And this is incredibly common in the influencer space in nutrition. Some influencer will promote some fear-based study, and then they're like, but I'm going to help you with this fear by selling you this supplement that I have. That's not something that somebody who's credible is going to be doing. And then, as we already talked about, any recommendations that are based on studies that haven't been published in peer-reviewed journals.
Got it.
And things that ignore differences between groups. Those are the 10 red flags of junk science that I think are helpful.
So these are all useful things to keep in mind as we're reading articles about various studies. Let's talk about the outlets themselves. there are obviously some biased outlets out there. There are outlets that are actually run by these influencers who are selling the supplements and whatnot. How can we make sure we're reading an outlet or consuming an outlet that's legit?
This is getting harder and harder because people will use their credentials. Maybe they're a doctor, maybe they're even a dietitian, or they'll use an association with a trusted medical group. And so that can be tricky when people are doing that. I know Mayo Clinic has ways that they try to intervene with that so people aren't using our name nefariously. But oftentimes what I do if I read something like that is I go back and I do a little bit more searching, like, who else is saying this? Are there other guidelines that talk about this same topic? There's the American Cancer Society, there's College of Cardiology, American Heart Association, American Diabetes Association, and these groups have guidelines committees generally that are made up of panels of people from very diverse backgrounds typically who spend years looking through all of the body of evidence and then typically grading that evidence in terms of its quality and its applicability to the groups that they're talking about. So, for instance, the American Diabetes Association will oftentimes talk about patients with pre-diabetes should do this. Patients who have diabetes on oral medications, these are the things we know. Patients with type 1 diabetes on insulin, these are the things that we know are helpful. Generally, medical guidelines are updated on a every 5 to every 10-year basis, so they try to stay current with them. It doesn't mean that the guideline is cut and dry because patients are individuals and they come to us with differences that are going to change how we apply those guidelines. But the science and the quality of what's been studied needs to be the backbone of that. And so oftentimes if I hear something on a social media site, I will go check to see, does this even align at all with the guidelines that exist? And just a lot of times, as I said earlier on, there's a bit of a kernel of truth. And so that's what gets us to click into it and say, oh, that sounds like it could be true. But then when you read a little bit further, it's not particularly helpful.
Where can people find these guidelines you're talking about?
Last time I counted, there are more than 20 different medical associations that have their own types of guidelines. So I would say it kind of depends what your interest area is or what your concern is. Nutrition were generally embedded into the larger medical guidelines groups. So within the American Diabetes Association, there are nutrition guidelines specific to that patient population. So for me, as a dietitian who works in cancer, the American Cancer Society has nutrition and physical activity guidelines. If your interest is in cardiovascular, if you've found out that you have high cholesterol and you're on TikTok hearing that you need to take omega-3 supplements, you might go to the guidelines for cardiovascular disease and find that there is a very limited subset of people for whom omega-3 fatty acid supplements are helpful at all.
So find the medical guidelines groups,
Yeah.
the legitimate ones.
Yeah.
And there are going to be well-studied guidelines that are going to be there.
And if you have questions, I think it's always appropriate to ask your healthcare provider, hey, I would like to know what are the actual nutrition guidelines for somebody with high cholesterol?
All right, so we've talked about getting news from various headlines, from social media and so on, but we'd be remiss not to also talk about AI. Nowadays, a lot of people are getting their health information that way, like typing in a question and then relying on whatever answer the ChatGPT gives them. So what are the risks associated with this?
I mean, there's so many possibilities that are so hopeful in medicine with the use of artificial intelligence. But when it comes to information and artificial intelligence right now, it's incredibly frustrating because anybody who's on the internet knows you type in that question. Now, the first thing that comes up is this AI review of the answers.
Even if we don't want it.
Even if we don't want it. And the thing about those AI summaries, they're always very easy to read, and it seems to synthesize the evidence quite nicely. That's wonderful. The problem is there are oftentimes inaccuracies, and AI is using information that's put into it. So if you haven't got good quality information going into the AI tool, the answers it gives are not going to be accurate. There have been many instances where people will read the response from the AI and there's just absolute inaccuracies in it. What I find helpful sometimes is going in and asking a question about, so if I were to say like, high-fat cheese, and then I would say hoax or misinformation. And if you type that, sometimes you'll get the opposite review of what you are hearing on social media or on TikTok. Because there are really good science communicators out there, and they will usually have their finger on the pulse of these fads that are popping up on TikTok and Instagram and whatever the new platform will be next year. And they're debunking some of those myths. So if you have one of those things that you think might be questionable, I will oftentimes put in debunk or hoax to see, is there somebody out there who can give me some better information about it?
I never thought about doing that. That's such a great idea. If you're trying to evaluate a scientific study, there are a few things you can look out for to see if it's legit. First and foremost, the study should be peer-reviewed. A good study should also be clear about what types of people were subjects, and it should acknowledge its own limitations. When reading an article or social media post, you can look for some classic red flags. For example, a story might promise a quick fix, issue a dire warning, or seem too good to be true. A suspicious story could oversimplify ideas or tell you to change your behavior based on a single piece of evidence. Also, beware of media that moralizes things as good or bad, and especially media that recommends a product. If something is based on a non-peer-reviewed study, overgeneralizes its conclusions, and or ignores differences between groups of people, you should approach it with a healthy dose of skepticism. You can also check what you learn against official guidelines from established healthcare organizations. Anything that radically disagrees with these guidelines is likely a questionable piece of information. And if you're still not sure, you can always ask your doctor. So now we know how to tell fact from fiction. But is it safe to take a piece of news as personal health advice? Let's find out how to translate what we learn into what we do. So let's assume we have done our fact checking. We've gone to the right associations online. We have found information that is reputable, that is accurate, that is backed by multiple studies. Even so, there's then the question, what do I do with this information in my own life? How do I know whether or not to actually apply what I think is useful here?
If you're reading the guidelines recommendations from a reputable group, they tend to be pretty specific. The American Diabetes Association or the American Heart Association, they have on their public-facing websites really good translational information talking about this is what the complex studies found and this is how you can apply that to your life. So you can go out and find, how do I take these recommendations and put them into my life? Another thing I will say is that if you meet with your primary provider and you say, hey, I just got diagnosed with prediabetes and I want to know, are there things with my diet that I can do that will help me? I can bet you can go get a referral to a dietitian and get some information that will be specific for how you live your life, because everybody's different. Because our job isn't just to give people a sheet of paper and say, this is what you do. Our job is to find out, what is your life like now? What is your day-to-day like now? Do you have kids? Do you end up spending an hour and a half in drop-off? How much time do you have at night by yourself? How do you eat now? Where do you eat? Do you eat at home? Do you eat at restaurants? And then our recommendations, we can tailor them to that patient's specific life. Can't do that on social media.
No.
So when you can meet with a dietitian or other health professional who can help counsel you about specific applications to your life, it's going to be what gives you the most bang for your buck.
and making it the safest. There's also the risk that we could injure ourselves or hurt ourselves in some way if we aren't getting proper guidance from someone who knows us, knows our medical history, knows our lifestyle, knows our age. What does that person on TikTok know about me?
And if you've got something that's very different from how you live your life now, I think it's okay to ask your provider, is this safe for me to do? A lot of times it's totally safe. There's no harm in it, but it's worth asking, because if it isn't safe and you're not checking in with your provider, we could go down the road of causing problems that were unintended. I had a patient several years ago who decided that he wanted to get more vegetables and fruits in his diet and started to do vegetable smoothies every single day. But the vegetables and fruits that he used commonly were really high in a particular component called oxalates, and it ended up causing him a bunch of kidney stones.
Oh my gosh.
And a lot of kidney damage. He was trying to do things that were really beneficial to his health, but in part because he was being very restrictive to sticking to this one specific thing to get all of his calories and protein. He was able to lose some weight, but he wound up with kidney stones, which was not a good outcome for him. Again, those extremes, like somebody telling you need to drink 3 of these smoothies that are nothing but celery and rhubarb for 2 weeks, anything that's extreme like that should give you pause to be like, that sounds like something that could cause harm.
Oof, yes. All right, so we're doing our best, but at the same time, we might still be getting misinformation from not even news sources, but from friends and family. The well-intentioned neighbor who's like, oh, I know you've been going through this. I just heard the other day that if you do ABC, there are huge improvements that you'll experience in just 2 weeks. What would you say about handling those conversations with well-intentioned folks?
30 years ago, it was just that eccentric neighbor down the road who would bring you a newspaper clipping.
Yes.
But now everybody has access to the internet and they want to help you out with what they've read. And of course, I see this in the cancer and nutrition space all the time. When people are diagnosed with cancer, people want to help them. And if I can speak from a very personal space, in 2023, I was diagnosed with breast cancer. I am a board-certified specialist in oncology nutrition, and I still had people tell me what they thought I should eat.
Oh my gosh.
With my cancer. And I was like, I love that you love me enough that you want to help me, but this is literally where my expertise lies, and that's inaccurate. So the way that I respond when somebody gives me information like that now is, I'd be interested to learn more where you heard that, because sometimes that will tick their brain like, oh yeah, I heard it on TikTok, and like maybe I shouldn't be talking about that as golden truth. And then asking questions about like, well, I wonder what type of patient they were looking at. And then I think it's hard because generally when people are bringing you information like this, they're coming from a place of caring. And I tell my patients this all the time. When you have family members or friends that want to give you information, it's okay to say to them, thank you so much for caring about how my nutrition is going. I'm actually working with a dietitian at Mayo Clinic throughout my care process, and she's helping me through these questions. And I think for a lot of people, that's what they want to know. They want to know that their friend is being helped and they're not missing out on information that they need. I will say, if you have someone you love who has been diagnosed with a disease, rather than your first thought being giving them information, maybe walk up alongside them and say, what can I do for you? It's hard to do because we think that information is always help, and sometimes it creates a little bit more stress.
Oh, that is such a kind response. That way it can be a conversation to actually, get closer to the heart of what was intended in the first place, which is just, I love you and I'm looking out for you and I want the best for you. So what can the average person do to try to stop the spread of misleading health claims and misinformation? I mean, I don't even know where to begin. It was bad enough when it was just our desktop computers, but now misinformation is being fed to us every single second of the day in our pockets. So how do we stop the spread of misinformation?
That is a great question, and I love it because we can help stop the spread of this misinformation. The first thing to do is to just stop sharing it. Whether you're sharing it to say, this seems crazy, I wonder if it's true, or this is interesting. The algorithms for social media and things like TikTok, AI, all of those are based on how many times people are sharing it, the engagement that any sort of post provides. And so one of the things we can do is just stop sharing it. And for me as a medical professional, that means when I read a story that I think is totally wackadoo about nutrition, I don't go in the comments and say, this is totally wackadoo.
Like, no,
I know.
this is not true. Do you not see that this guy is selling you a protein powder?
It is really tempting just to go in there and be like, that's not true. But that's engagement. That drives that information up higher. I ignore it. I maybe go to another post that has correct information, and I do engage with that one. I say, this is great information, because the more you share the right information, you help to generate algorithms that are giving us better information. I think it's incredibly important to have some high-quality medical health news sites on your feed. Follow Mayo Clinic, follow the American Institute for Cancer Research, because when those things are popping up on your feed and you're engaging with those evidence-based information, that changes the algorithm. It also changes your algorithm, so you get more evidence-based information. We're not going to fix things entirely by doing that, but things that get attention are things that get shared. And things that get attention, just like that 2-year-old, they want attention, whether it's good attention or bad attention. The attention drives the engagement, and that puts that post on more people's feeds. That gets more clicks, that gets more money. And do share the things that you find credible and accurate from credible sources.
All of this is so helpful. Do you have any final wisdom you'd like to impart?
I know that it's challenging in this environment to sift through all the information. And it's okay to be frustrated with the information, but be curious. Continue to be curious. If there are things that don't necessarily align with your specific ideology, I don't care whether you're a patient or whether you're a physician, you should be curious about why other people are interested in this approach. Because when you're curious about it, you're more likely to be able to have these engaging conversations and find out what's best for you. That's what we're all here for. We are not here to shove information in people's faces. We're here to help you live better, healthier lives.
What a beautiful note to end on. Joy Heimgartner, this has been such a pleasure. Thank you for all of the advice, all of the tips that we can start enlisting today. We so appreciate it. Thank you.
It was a pleasure to be here. I thank you and your team so much for having me.
If you're looking for health information to apply to your own life, guidelines from reputable organizations can give you specific and accurate advice based on your health concern. And if you're looking for something even more tailored, specialists like dietitians can incorporate your own personal medical history and lifestyle into their guidance. It's also perfectly reasonable to ask your doctor before trying something new to make sure it's safe for you specifically. And if you're getting unsolicited health advice from a friend or loved one, remember that it's often a misguided way of expressing care or concern. Sometimes the best move might be to simply thank them for the information or reassure them that you have professional guidance. Other times, you might be able to gently and kindly question that information. It's important to be curious while still reserving some healthy skepticism. And if you want to stop the spread of misinformation, don't take the bait. Misinformation benefits from any and all attention, whether it's likes or an enraged comment. Instead, try to deliberately add reputable medical organizations to your media diet and engage with things that you know to be accurate, evidence-based advice. It may feel like a drop in the bucket, but at the very least, you can make your own media ecosystem a little bit healthier of a place to be. Okay, that's all for this episode. But if you've got a question, a topic suggestion, or a follow-up question about this episode, you can leave us a voicemail at 507-538-6272. We might even feature your voice on the show. For more Health Matters episodes and resources, head to mayoclinic.org/Health Matters. And if you found this show helpful, please subscribe and make sure to rate and review us in your podcast app. It really does help others find the show. Thanks for listening, and until next time, take care and stay healthy.